Hey everyone, today we are going to discuss a very important topic, that is anemia of chronic disease. Do you know it is the second most form of anemia after iron deficiency anemia worldwide? So please jot down all the key facts. Don't go anywhere. Stay tuned, and we are going to have lots of learning, and it's going to be a very productive session, very productive video. So what is anemia of chronic disease? Anemia of chronic disease is typically associated with various kind of chronic inflammatory conditions. Now what are those? Those could be rheumatoid arthritis, it could be tuberculosis, rheumatoid arthritis, some autoimmune diseases like lupus, or it could be some various kind of infections like tuberculosis, infective endocarditis, osteomyelitis. These could be some of the important conditions. So all chronic disorders, autoimmune disorders, chronic infections, and long-standing or even malignancies, so various kind of malignancies, lung malignancies, breast cancer, they can also be associated with anemia of chronic disease due to significant inflammation associated with them. Now, what is the mechanism? Just note down what is the mechanism, how it is caused. It is caused due to underlying inflammation, and there is a significant surge of interleukin production, IL-1, IL-6 and TNF. So what happened, guys, in that there is this IL-1, IL-6, TNF, they stimulate the liver to synthesize acute phase reactant, that is hepcidin. So hepcidin is uplifted. Now what is the work of hepcidin? Hepcidin goes and blocks the release of iron. Iron is available in ready amount, but it is not getting released from the macrophages. So as you all know that iron is getting stored in the bone marrow macrophages. Now it is not getting released, it is getting trapped inside the macrophages. We call it as iron trapping. Remember, iron trapping, that is the most important feature of anemia of chronic disease. Apart from that, hepcidin and interleukin 1 and IL-6, this surge can also lead to decreased response of erythropoietin, and also decreased erythropoietin production by the kidney cells. So these are some common pathogenic mechanisms by which anemia of chronic disease is caused. So here generally the hemoglobin is in a moderate range, around up to 9-10. It remains like that, it doesn't go below that. And here lab investigations will reveal typically all will be, all iron indices will be decreased, whether it is serum iron, whether it is transferrin saturation, or total iron binding capacity. Everything will be decreased except for serum ferritin. So serum iron, serum TIBC, transferrin saturation all decreased, but serum ferritin is raised because the storage form of iron is raised. So because of the increased ferritin, there is decreased TIBC, there is decreased transferrin synthesis, and also decreased saturation. That is easy to understand. And there will be it may be having normocytic normochromic anemia initially, but later on in many of the cases there is microcytic hypochromic anemia. So generally it comes under the category of microcytic hypochromic anemia. So how to manage these patients? So these patients, the best management strategy is to manage the underlying cause, that you have to do. So without that, there is no point in giving some blood transfusions or erythropoietin. You may give still erythropoietin, and blood transfusions may be recommended in cases where it is needed, because anemia level is high and hemoglobin is going down to less than 9, which rarely happens. But the treatment of underlying cause, management of inflammation, underlying inflammation is the most important part of the management of anemia of the chronic disease. So that's all for anemia of chronic disease. So hope you liked the video, and please share, like and subscribe, and tell us what next topic video would you like to have, what next video would you like to prefer. Thank you.